Okay, Lonnie, thank you for this reconvening of this council committee for people with special needs and disabilities and public health and human services. I want to thank my fellow members of council who are here for being able to stay with us this afternoon. I know the chair of the Public Health and Human Services Committee, Cindy Bass, is present, as well as council member Catherine Gilmore Richardson, council member Isaiah Thomas, council member Maria Kiona Sanchez, and council member Helen Gim. I want to thank Tom Earl for his earlier testimony, as well as Brian Green. If our clerk, Mr. Frank Iannuzzi, could read the next panel.
Judith Emmons, Brenda Shelton-Dustin, Joe Mancini, Asher Kemp.
And thank you all for your patience. If you could testify in that order.
Hi, can you hear and see me?
Yes.
Okay, great. Thank you. I'd like to start by saying Councilmember Green, Councilmember Bass, and other distinguished committee members, I thank you for this opportunity to address Resolution 200310 and for hosting this joint hearing to address the striking disparities of coronavirus infections and the impact they've had in Philadelphia communities. It's encouraging to see the thoughtful coronavirus racial equity interim plan that was released by the city just this week. I'm here representing my role as Director of Primary Care at Congreso de Latinos Unidos, where I oversee our federally qualified health center. In FY19, Congreso served over 15,000 individuals, most who reside in North Philadelphia, over which 60% recorded an annual family income of less than $10,000. 67% of these individuals identified as Latino, and 33% identified as Black, and 57% of our clients reported their primary language as Spanish. Our FQHC operates in a federally designated medically underserved area, which means there are not enough medical professionals in our community to meet the need. At our health center, we offer primary care services and a host of other supportive services to our patient panel, which consists of over 3,500 Philadelphia residents. And we also serve as one of the public coronavirus testing sites in the city of Philadelphia. It's clear that from the city's data and our own observations that racial disparities are disproportionately contributing to more severe negative health outcomes of coronavirus here in Philadelphia. We know that from recent data from the Philadelphia Department of Health that Blacks and Latinos make up over 70% of total coronavirus hospitalizations in our city, meaning these groups are disproportionately experiencing the most severe outcomes attributed to the infection. I can affirm from the work that I do that the disparities we are seeing are less about pre-existing conditions like diabetes or hypertension, and much more about the structural factors and social determinants of health that contribute to these risk factors. It is a common understanding in public health that the zip code and neighborhood conditions you live in have the most impact on your health outcomes. And actually in Philadelphia, the difference in life expectancy across zip codes is one of the starkest in the country. The patients served at the Congreso Health Center are often dependent on safety net social services, which have been compromised and continue to remain in jeopardy. Food insecurity in the first weeks of the pandemic was something that our medical providers saw multiple times per day. Telehealth visits for patients' chronic diabetes turned into conversations about where to acquire their next meal. This highlights just how unstable food security is within these communities, how close to the poverty line people are really living, and how another interruption could quickly put us back into that situation. The families we serve continue to struggle with increased behavioral health needs as a direct result of the pandemic, and the PHMC network of health centers has seen a 29% increase in behavioral health visits since the start of the pandemic. The Congreso Health Center serves a population of workers in which many do not have the privilege of staying safe at home. Many of them are working in essential industries such as labor and service delivery that keep the city going through the shutdown. Most of the workers in our community also do not have savings or financial security to fall back on. And many of these essential workers also have pre-existing conditions that put them at a higher risk for more severe outcomes. However, they still continue to work because they have no other choice. And sadly, some continue to work even if they're feeling sick, which can facilitate the transmission to others in the community. Additionally, the current delay on coronavirus testing results only further exacerbates the spread of coronavirus in vulnerable communities, and our medical providers do not have access to timely, accessible data that can help them make decisions for those who test positive and are at risk for more severe health outcomes. In April, the Congressional Health Center experienced an influx of new patients from a virus outbreak at a food processing facility, and that outbreak was worsened by the fact that the employees had mixed legal status. These employees shared with our medical providers that they were unable to stop working even as those around them became sick, that their employer did not allow for paid sick leave, PPE, or even opportunities for social distancing in the workplace. Beyond their increased occupational exposure, many were living in crowded housing arrangements that further exacerbated this situation. Fear of deportation or immigration-related violations is also preventing many undocumented Latinos and Latinos living in mixed legal status households from seeking testing and timely treatment for coronavirus. And under those circumstances, contact tracing among Latinos can even be further impeded by concerns about immigration consequences. Safety is also a chronic concern in our community, and as one of the 4 domestic violence service providers in Philadelphia, Congresso knows this all too well. During one telephone session with a domestic violence client, our advocate noticed that the client did not sound well. The advocate assessed the client's symptoms and determined that she met the criteria for possible coronavirus infection. However, the client disclosed that she had been sick for some time and was afraid to seek medical attention due to not having legal documents and medical coverage. A safety plan was created and the client was directed to medical care. However, she did not have the ability to safely quarantine within her house, and one of her children, unfortunately, also tested positive for coronavirus. Unfortunately, these are just 2 of many similar stories. Philadelphia's leadership and decision makers have a moral, economic, and public health responsibility to protect all people, regardless of race or socioeconomic status. In terms of coronavirus, we can do this by reducing barriers to testing and treatment, advocating to employers to ensure that people can work safely in quarantine, and by building trust and promoting cooperation with culturally competent contact tracing teams. But for the ongoing issues that continue to threaten the overall health and well-being of these communities, we must all commit ourselves to save Black and Brown lives through dismantling systemic racism and discrimination in order to address the social and structural determinants that are ultimately contributing to the disproportionately poor coronavirus outcomes in these communities. I'd like to end with a quote from Martin Luther King Jr., who said, "Whatever affects one directly affects all indirectly. I can never be what I ought to be until you are what you ought to be. This is the interrelated structure of reality." Thank you for your attention to this important issue and your commitment to the health of all Philadelphia residents.
Thank you for your patience, for being here and the work that Congresso does every day. I believe next will be Brenda Shelton-Dunston.
Good afternoon, everyone. I'd like to thank you, Councilman Green, as well as Councilwoman Cindy Bass, for allowing me to testify. I am the Executive Director of the Black Women's Health Alliance, on improving health and health outcomes targeting African American women and women of glass that has highlighted the larger pandemic of health disparities and racial and systemic inequities. A crisis within a crisis for our community. The historical landscape of spiraling disparities at rates 2 to 3 times greater than the white community, and the resultant morbidity and mortality in the Black community was and is fertile ground for the virulence of COVID-19. Our organization was honored by City Council back in June 2011 and for our Creating a Legacy of Wellness, Mind, Body, and Spirit initiative. In June 2nd, that day was Creating a Legacy of Wellness, Mind, Body, and Spirit Day for the city of Philadelphia. Basically, we were and still are uniting and mobilizing and working with diverse leaders to focus on improving our issues. We were able to roll out a program called Prime Time Sister Circle it's an evidence-based program focused on improving weight, which it did. 68% of the women lost weight, 40% of the women reduced blood pressure, over 300 women have participated in that program. Unfortunately, we have not been able to maintain consistent funding of that project. Some of the recommendations that I'd like to give is there's an urgent need for development and implementation of policies that support these initiatives that focus on racism, conscious and unconscious, and the health and systemic inequities that exist within our healthcare systems and health at all levels. We want to be able to conduct this work in a transparent lens by honestly examining and developing comprehensive strategies with involvement of all stakeholders. Peeling back that onion, it may not feel comfortable, but it needs to be peeled back. We must remove the back to advance well-being in an inequitable world. There are some other programs occurring in other cities, such as Pittsburgh, where there has been established a Black-led collaborative looking through a racial equity lens, zeroing in on the racial disparities of education racism. We need to explore all options. There also is work, and I'm involved in this as well, occurring with the Pennsylvania Office of Health Equity Advisory Committee. I was pleased to hear Dr. Farley mention that some work has been occurring here in Philadelphia that I'd like to get involved with, and I will review that report that I understand was published today. Dr. Alice Sanford, the reason we need to be at the table for these conversations and have individuals at all levels involved in these conversations and meetings is because you're bringing different skill sets and information that may not be readily available. She zeroed in on hospital, the way it operates, and where the money is, how it might be opportunities. And she is absolutely right. There is opportunity there. The focus and purpose of those funds going to the hospitals is for community. So it's lifting up those conversations, digging in, and identifying where those intersections occur. And sometimes, we get involved in our silos. I'm not saying that it may not be that it is deliberate, but it could be an opportunity with all of us being at the table, coming at solutions, developing solutions, utilizing our different expertise and knowledge to address some of these issues. And I'm talking about including community residents, valuing, and I'm really serious about valuing their input. We may be involved in these committees. We are getting paid. We need their input, and we have to value that. This is something that I'm hearing a lot from community residents as far as their input is always requested for attending meetings, and they may get refreshments or they may get transportation. They may not, in the time of virtual, they may need assistance with, the cable bill or whatever. But I'm saying valuing that input, because without our community residents who are going to the hospitals, going to the health centers, generating the revenue upon which the salaries are paid, it would not exist. The same, looking at that same lens as far as research, it's a research issue as well. we value that contribution that is being made by individuals who are considered as essential workers, individuals who may not be earning a living wage, but we're calling upon them for their time. Their time equals value. As also talked about need for a comprehensive plan to focus on and address, going back to racism, conscious and unconscious, and health and systemic inequities that exist within our healthcare system at all levels. Examine and improve those cultural competencies. Currently employ health providers and integrate comprehensive racism courses into curriculums for students enrolled in health professions programs. We got to go back and pull forward. This racism issue is one that is embedded into our society, into our souls. It's an opportunity, and it is time for us to bring that education. COVID has placed health status on the radar in our community. Use it as an opportunity. It's an opportunity. We have their ear. Maybe not as much as we'd like to, but we have their ear. People are listening somewhere. But use that to increase awareness of steps that can be taken to reduce our vulnerability to COVID-19, health disparities, disparate conditions now, those that will be in the upcoming fall, winter, and thereafter. Fund Black-led community-based organizations to conduct evidence-based interventions effective in reducing health disparities. The whole health and educational awareness campaign. Partner, this is fun. Partner with governmental funded contractors to assist with COVID-focused program outreach. There's a lot of funding occurring out there. And a lot of times it is not those organizations that are Black-led, community-based, owned and operated organizations who have an ear to the community. Let's lift it up. But it has to be valued. That knowledge and that relationship with the community has to be valued, and it is one that needs to be supported. Thank you.
Thank you for your testimony. We're going to wrap up with Asher Kemp and Joe Mancini. If you both can summarize your commentary. Also, I want to thank Ken Lawrence, the Vice Chair of the Montgomery County Commissioners. Due to some work, he was not able to get on to today's call. Also, we received written testimony from Charles Horton, who is now the Senior Director of Advocacy and Inclusion at Inglis House, Dr. Emma Chappelle from the Black Women's Leadership Council, also Judy Henderson, who was here through most of the day but was not able to testify, did also provide written testimony, as well as Dr. A.O. Marie Golden, President of the Delaware Valley Association of Black Psychologists, Dennis Cook, President and CEO of West Health, and Shane Janik, Executive Director of the ARC of Philadelphia. So we can go with Asher Kemp and then Joe Mancini, and then we'll wrap up the hearing. Asher, we cannot hear you. Hello? Asher, we can't hear you. So why don't we, Asher, we try to work with you in technology-wise. Let's go to Joe Mancini, and then we'll come back to Asher.
Councilman, can you hear me?
Yes.
All right, everyone. Thank you very much for your time today. My name is Joe Mancini, and I'm the Executive Director of Region 2 for Kencrest Services in Philadelphia. We're one of the largest providers of residential services for individuals with intellectual disabilities in the Philadelphia area, and our services span across 3 different states. Again, I want to thank you for allowing me the time. And although Sunday was the 30th anniversary of the ADA, and we have made significant strides in the push for equal rights for people with disabilities, individuals with disabilities are still often ignored when the topic of discrimination is discussed. Forget how, in the not so distant past, individuals with intellectual and developmental disabilities had been locked away, hidden from the general public and institutions because our cities were not equipped or did not want to address their needs. To this day, we are still struggling to create appropriate housing to move individuals from institutional settings. This pandemic is creating excuses for the general public to begin to hide those we support back in their homes, and because of the challenges accessing the community during this pandemic creates. I know we're short on time, and we have written testimony here, so I just really want to skip down to the part that discusses our need for support with direct support professionals. Residential programs like ours operate on a limited budget due to the rates set, and we often lean on other programs within our organization to offset the cost of operating our residential program. This pandemic has shut down day programs, early intervention programs, limited our employment and supported living programs, all of which we use to assist our residential program. We need support in educating legislators on the need for rate increases to hire additional competent staff that support our people in the community. Smaller residential programs will close without this support, and I believe that was mentioned earlier, some of the support that's being received, but we need more. And this will not only be heartbreaking for those that have established comfortable lives with these programs, but will also create additional stress on those that have to support the needs of the programs supporting individuals moving. Direct support professionals are grossly underpaid. Sorry, I lost my place. Direct support professionals are grossly underpaid, many of whom are women, immigrants, and people of color that are not earning a living wage due to these rates. Quality DSPs are leaving these programs to find safer, less stressful, and higher paying jobs. A recent study by a large consortium of private service providers found that residents of group homes and similar facilities in New York City and surrounding areas were 5.34 times more likely than the general population to develop COVID and 4.86 times more likely to die from it. The Pennsylvania Department of Human Services reports that as of June 2nd, there were 801 confirmed cases and 113 deaths among people with intellectual disabilities and autism. Those we serve estimated at 4.5 times greater rate to die from this disease, and we are creating work situations that drive away quality people that support them. To have a break-even household income, they need a $90,000 per family of 4, and that's just not something we're allowing with these rates. With a competitive wage, we could keep these quality staff in place while they work. While the work of these dedicated direct support professionals has always been challenging, this pandemic has made this work life-threatening. We have lost amazing staff to this disease, and they literally have put their lives on the line so others can have a semblance of an everyday life. They need a rate that matches their dedication and sacrifice and allows these staff to continue to support people with disabilities and accessing their rights to full community engagement. Thank you for your time, everyone.
Thank you, Joe. We'll try Asher Kemp once again. If we can't hear from him, I want to thank him for his testimony. We'll have it included as part of the record, the great work that his organization does in providing information and resources and services on culturally competent providers in the behavioral health space. Mr. Kemp, can you hear us? Okay, you can hear me, but we can't hear you. So thank you for your patience. I really do appreciate you being here and all the great work that your organization has done. Too often when we're talking about these issues, we talk about one aspect of health, but not the behavioral health aspect of this, and your organization provides great work. I want to thank all of my colleagues who participated in this hearing. I know it's been a long hearing. Thank you for your patience. I also want to really thank my staff, Frank Iannuzzi, for helping to put together this hearing, as well as all the technical staff from the Chief Clerk, Mike Decker, as well as Lonnie and Modesto and all the technical staff and City Council. I know it's been challenging, but thank you for your work for this great hearing. Also want to thank my colleague, Councilmember Dom, for his indulgence as we're about to start his hearing. And I recess this hearing to the call of the chairs. And that will be myself and Councilmember Cindy Bass.